for not just your own growth, but for the growth of the faculty and the growth of the university. Right, my name is Faridah binti Abdul Aziz. I'm a professor of the Biomedical Imaging Department, which is also known as radiology. So I'm a professor of radiology. Currently, I am the Dean of the Faculty of Medicine, Universiti Malaya. I'm one of those people that was affected by TV shows. So when I was growing up, there was this particularly, to me, inspiring TV show called Quincy M.E. It's a medical coroner. So in this particular TV show, so he's a doctor. He's specializing in, cutting up dead people, of course. And he also solves crime. So to me, that was like fantastic. Not only did I know I wanted to do medicine from that TV show, I actually wanted to be a forensic pathologist. I was so clear. That time I was about 14 years old. What do? Well, of course, I interpret images. I talk about when the images are diagnostic or non-diagnostic. So what are images that I interpret? I would interpret different modalities such as plain radiograph, of course, that's the bread and butter. We do contrast imaging as well. I interpret ultrasound images, I interpret magnetic resonance images, CT scan images, as well as nuclear medicine images. In particular, my field is cardiac imaging. So I basically started the service of cardiac imaging in Universiti Malaya Medical Center and incorporated into the curriculum of our Masters of Radiology, particularly in CT scan and MR of cardiac imaging. Fun fact about my specialty. The fun fact about my specialty is that it is ever evolving. This is one specialty that you cannot stay where you are. The technology is moving, and now with AI knocking on our door, all the more we need to evolve with things. So this is one technology that if you don't move with it, it'll leave you behind. So definitely I had support from my friends. I had support from colleagues here in the faculty. I had support from my family, and I spoke to my husband as well, and he is one of my greatest supporters. So I think that was what led me to this decision. So two things: support, having the confidence of other people, telling that they feel that I could do it. And number three, because I've kind of been there before, maybe not as a dean, but I've been tested and I felt that I could handle it. And I think the main challenge is definitely going to be managing conflict. You want to manage conflict, at the same time you want to create positive change. So we need that positive change and strategy, and yet at the same time you have to manage conflict and manage change management. So I think those are the two things. It needs to be a fine balance. You need to lay the law. You need to make sure that the core activity of the faculty is looked after and should be prioritized and protected. Yet at the same time, you need to have the creativity and the allowance of letting the people in working for this organization be free to have ideas and come up with innovative things or things that can grow their career. Universiti Malaya remains the number one. I think it's because when we bring in people, we make sure the selection is targeted towards bringing the narrative of Universiti Malaya ahead. When we want to bring you in, it is very important that we choose people like you. There is attitude, there is the confidence that you must have, there is the ethos of teamwork, working together, and yet putting Universiti Malaya in whatever you do, understanding that you're doing it for not just your own growth, but for the growth of the faculty and the growth of the university. Of course, we have to prepare the curriculum, right? So when we prepare the curriculum now, okay, there are a few things now in both our undergraduate and postgraduate healthcare curriculum that we're paying attention to. Number one is, of course, digital, digital and AI. We're putting it into our curriculum, both at undergraduate and postgraduate level. The other thing is sustainability, green initiative. We're already looking at putting it into our curriculum. So these are evolving things. So So when we put it in our curriculum, we ensure that the people coming out understands that when they are doing, currently these are the important or emerging things. But when you move forward, you must always keep an eye out on emerging things. The thing is, for the faculty, I've not been dean for a long time. So a lot of the achievement that you've achieved was actually under Prof. April, the previous dean, and probably Prof. Adiba, the dean before that. So I'm going along on the wonderful path that they have set for the faculty. But I have to admit, every time I see our students doing well, even if I see our students running their own conference, doing their own workshop, and I could see the leadership capabilities that's coming out of it, I feel proud. And I think recently in the Anugerah Cemerlang Universiti Malaya, we had quite a number of non-academic staff being recognized as excellent in their own field, and a lot of them as lifelong learners. And I think that happened on my 3rd or 4th day of being dean, and I went for this ceremony, and I was so proud of them because they are non-academic. They are doing this because they are in an environment that encourages them to do it. And I felt proud for the faculty. I felt proud of us for encouraging even the non-academics to be excellent. We are actually a member of an alliance called the Alliance of Academic Health Centre International, which is AAHCI. Now, we became a member of AAHCI when we wanted to move the idea of harmonization between the faculty and Universiti Malaya Medical Centre. But because of our involvement with AAHCI, and they actually came to audit us to see our readiness, and they said we were ready, it created this huge project called Health, which we are still working on. And instead of harmonizing between Faculty of Medicine and Universiti Malaya Medical Centre, it has now become a collaborative practice. Basically, we are now trying to merge 3 faculties: Faculty of Medicine, Faculty of Pharmacy, and Faculty of Dentistry, and 2 hospitals, Universiti Malaya Medical Centre, Universiti Malaya Specialist Centre. So these 5 entities are going to be known as Health. This is huge. This whole entity becomes an academic health centre that has a private portion of it and a public portion of it. But what we want is excellence in everything. So we're going to have education, we're going to have healthcare, going to have research, all those arms working beautifully together to do this. So I don't have day offs. I have off minutes and off hours in a day. I will always make sure I have protected time. Sometimes it's difficult, but I have protected time for myself. And I usually, as you can know, if I watch Quincy ME, I love looking at the idiot box. I think it just calms me to just not do anything and just watch someone else running, someone else talking, and someone else, doing things and making decisions, and I can just watch someone else do it. So I actually do that, and I am an avid reader. I've always liked to read, so I tend to do that a few, like half an hour to 1 hour every day. Just find time to do that. So those are the 2 things I do. When I graduated for my Masters of Medical Education, which I graduated in 2022. So that's very, very recent. What happened was that, so I was wearing my master's robe, and I went to register, and the staff in the university, some of them recognized me because, as I said, I was deputy dean then. I've been called for strategic meeting, so they know me, right? So when I came to register, and they look at me and they said, "Prof, bukan kat sini. Ini untuk graduan. Prof kena pergi academic procession," because the academics are also lining up to go for the graduation. So, and I looked at them because I didn't expect them to say it. And then suddenly they realized the robe I was wearing. They said, "Are you graduating?" you graduating, Prof? And they got excited, you know, and I felt that was nice. But it didn't end there, because when I got on stage, the stage was full with my friends. And they laughed and they cheered and they went whoop and clapped. And I think the parents of the undergraduate and the postgraduate there must be thinking, who is this old woman that everybody is so like, you know, like they were clapping for me and things like that. But that spirit, that as I came up and having a whole stage full of people just wishing you well, that really made me feel like I'm home. And that was memorable for me. Very, very nice.